We will continue our decreasing risk exposure discussion by focusing on building safer medication systems. Medication issues account for a large number of errors that put the healthcare organization at risk. At the end of this module, in addition to the objectives covered in our first presentation, you should also be able to do everything listed on this slide. You may be asking yourself, what does medication errors have to do with those of us who do not plan to be involved in direct patient care? It is important for a lot of reasons. Medication errors not only have the potential of harming our patients, but they can also put the organization at risk for litigation. Even if the organization does not get sued, the financial impact can be huge. Statistically, 2 patients out of every 100 patients will have some type of medication error. On average, this will add over 4.5 days to their length of stay, resulting in about $6,000 to the cost to care for that patient. For a 700 bed teaching hospital, that is about $2.8 million a year. Medication errors also have other costs to the organization and healthcare providers, including increased malpractice insurance premiums, marketing costs associated with minimizing the impact of negative news media, and higher employee turnover, decreased operational efficiency due to practicing defensive medicine. Those all affect the organization's bottom line and all employees. The first step to building a safer medication management system is to select and procure medications. Maintain and annually review the formulary. This should include reviewing the indications for when a medication is to be used, its effectiveness, any associated risk with the medication, and cost. The next step is to properly and safely store medications. Inspect all medication storage areas. The conditions should be suitable for patient stability. This includes storing meds at the appropriate temperature, and controlled substances should be double locked. Care should be taken when using the patient's own medications. Step 3. Order or prescribe and transcribe medications. Policies and procedures must specify the required elements of how orders are written or communicated. This should include the list of abbreviations that are not acceptable to use when ordering or communicating medication orders, acceptable use of verbal orders, and readback requirements. Step 4 is to prepare and dispense medications properly. How medications are selected, compounded, packaged, and labeled all must be done carefully. The pharmacist must review each prescription or medication order for appropriateness. Step 5. When administering medications, at least 2 patient identifiers prior to the administration of medications should be used, along with a unit dose system. Maintenance of an accurate medication administration system is important. Remember the 5 rights: the right patient, the right drug, the right dose, the right route, such as orally, subcutaneously, intramuscular, or an IV, and at the right time. The use of an automated bedside point-of-care barcode scanning system can also reduce the number of errors, if used correctly. Step 6. Monitor the effects of medication on patients according to the clinical needs of the patient. Address the patient's responses to the prescribed medication and actual or potential medication-related problems. Which brings us to our last step. Your medication management system must be evaluated. Your pharmacy and therapeutics and your medication safety committees should be involved. You would want to identify and analyze any medical or medication errors and include any near misses, those errors that were caught before they actually reached the patient. By following these steps, the medication errors occurring in your healthcare organization can be greatly reduced, and your risk exposure will also be reduced.